Assalamu alaikum to all of you. My name is Nemat Rasool. In the previous lectures on circulation, we have come to know that how the arterial pressure is regulated within the body during the resting phase. But today we will discuss how the blood flow, the arterial pressure, and the cardiac output increase during the exercise. Later we will discuss the coronary circulation, and in the end we will discuss the ischemic heart diseases, which are actually relating with the coronary circulation insufficiency. During resting phase, the rate of the blood flow is 3 to 4 ml per minute per 100 gram. But it isn't the case during exercise. The rate of the blood flow may increase from 3 to 4 ml to 100 to 400 ml per minute per 100 gram of the skeletal muscles. It means that during exercise, the rate of the blood flow increase from 25 to 50 folds. Same is the case with the cardiac output. The cardiac output also increases 6 to 7 times during exercise. How the blood flow and the cardiac output increase during exercise, we will discuss it in detail in the coming slides. The next one is the blood flow during muscle contraction. During the exercise, the muscles perform strenuous work. More blood moves from arteries towards arterioles and then towards capillaries, as a result of which there will be the more opening of the capillaries and it increases the surface area 2 to 3 times. The next one is how blood flow is controlled in the skeletal muscles. There are actually two mechanisms which are controlling the rate of the blood flow in the skeletal muscles. The first one is the local arterial vasodilatory mechanism and the second one is the nervous control mechanism. We will discuss the first one, local arteriolar vasodilatory mechanism. Whenever muscles perform exercise or strenuous work, the first thing happens in the muscle is the reduction of the oxygen. The reduction of the oxygen, which is called the hypoxia. Whenever there is a hypoxia in the muscle, it causes the release of the vasodilatory substances such as the adenosine, the carbon dioxide, ATP, lactic acid and the potassium ions. These vasodilatory substances in turn cause the vasodilation of the vessels. The next one is the nervous control, which control the rate of the blood flow. There are two types of nerves which come under the nervous control. One is the sympathetic vasoconstrictor nerves and the second one sympathetic vasodilator nerves. But there is a difference in the action of both these nerves because the sympathetic vasoconstrictor nerves cause the release of the norepinephrine that acts on the alpha vasoconstrictor receptors, which in turn causes the vasoconstriction. But it isn't the case with the sympathetic vasodilator nerves because they release the epinephrine which act on the beta adrenergic receptors and in turn causes the vasodilation. In addition to the sympathetic nerves, the release of the norepinephrine and epinephrine, the adrenal medulla also secretes large amount of the norepinephrine and even more epinephrine into the circulatory system. Next, there is a circulatory readjustments during exercise. There are three things which are actually happen during the exercise. The first one is that the sympathetic nervous system activation. The second one is the increased arterial pressure and the third one is the increased cardiac output. Whenever there is activation of the sympathetic nervous system, then more signals are transmitted from the brain to the muscles and also to the vasomotor center. What is the vasomotor center? It is actually a combination of the lower part of the medulla oblongata, the respiratory center, and the CVS center that regulates blood pressure. As a result of the sympathetic nervous system, there will be increased heart rate and pumping strength of the muscles. Whenever there will be increased heart rate and the pumping strength of the muscles, there will be the more pumping of the blood from the heart towards the arterioles, towards the arteriole. Whenever there is a increased heart rate, then there will be more pumping of the blood from the heart towards the arteries and arterioles and capillaries. The second is the contraction of the vessels or the peripheral circulation. Whenever a muscle is performing as exercise, then more blood flows towards the active muscle as compared to the non-active muscles. Or you can say that the more blood moves toward the functional muscle as compared to the non-functional muscle. The third one is the muscular walls of the veins contraction and increased venous pressure. Whenever there is the contraction of the veins, it causes the increased cardiac output as a result of the increased venous pressure. The second thing which happens during exercise is the increased arterial pressure. The arterial pressure increases because of the increased pumping of the heart. The second one is due to the vasoconstriction of the small arteries except heart and brain. And the third one is that the arterial pressure increases due to the mean systemic filling pressure. Increase in mean systemic filling pressure, it means that whenever there is the more contraction of the muscles during exercise, then there is an increased venous return towards the heart, as a result of which there will be the increased cardiac output. Whenever there is an increased cardiac output, it provides more oxygen and nutrients to the muscle. So up till now, we have discussed three readjustments which are actually happening during the exercise. The first one is this activation of the sympathetic nervous system. The second one is the increased arterial pressure, and the third one is the increased cardiac output. The next one is the coronary circulation. The heart is supplied by the right and the left coronary arteries and their branches. Whereas 1/3 millimeter of the endocardial surface get its nutrition directly from the blood, which actually comes within the arterial The venous return from the left ventricle goes to the right atrium via the coronary sinus, whereas the venous return from the right ventricle goes to the right atrium directly via the anterior cardiac veins. There are also the small venous blood that returns to the heart by the Thibsian veins, which are also called the small marginal veins. The next one is the ischemic heart diseases. Whenever there is a blockage of the coronary arteries, whenever there is a coronary blood flow insufficiency, the hypoxic condition produced in the heart, which cause pain in the area surrounding the heart and in the heart muscles, which is called the ischemic heart disease. It is painful. There are two causes of it. The first one is the atherosclerosis and the second one is the acute coronary occlusion. What actually happens in the atherosclerosis is that there will be the cholesterol deposition within the endothelium, and then it is deposited by the fibrin, and there is a formation of the atheroma. This atheroma can cause the partial and entire blockage of the blood vessels. Atherosclerosis, the second cause, ischemic heart disease, is the acute coronary occlusion. The patients who are suffering from the atherosclerosis may develop the acute coronary occlusion. Atherosclerosis is the cause of acute coronary occlusion. Two things happen in acute coronary occlusion. The first one is the atherosclerotic plaque may form thrombus or embolus. The atherosclerotic plaque detaches from the endothelium and it is entrapped between the platelets, red blood cells and the fibrin, and it forms clots. This clot, it is called thrombus. The thrombus which it forms may be localized or may be delocalized because it can flow and form the embolus and causes the embolism. The second effect which produces in the acute coronary occlusion is the spasm of the smooth muscles of the coronary artery. Whenever there is a spasm of the smooth muscle of coronary artery, there will be the contraction of the coronary artery and there may be the occlusion of the vessels that cause the less blood supply to the heart. The patients who are actually suffering from the atherosclerosis may develop the acute coronary occlusion. Whenever there is the occlusion of the coronary arteries, then there will be less blood flows to the heart muscle. As a result of which, the blood flow ceases in the coronary vessels beyond occlusion, and area of the muscles with zero or little blood supply becomes non-functional and causing MI. People can see here, this is non-functional area which actually develops during the myocardial infarction. During the myocardial infarction, the area of the muscles with a zero or little blood supply becomes non-functional. You people can see here, this area becomes non-functional because of the zero or the little blood supply. And what next happens? Whenever there is a blockage of the coronary arteries, then the small collateral blood begins to flow. But that collateral blood, it isn't enough to provide the needs of the heart muscles. Then as a result of which the ischemia may develop, deficiency of the oxygen may develop. As a result of which there will be the hypoxia. The hypoxia in turn causes the vasodilation of the local blood vessels, which in turn causes the muscle to use the lost oxygen of the hemoglobin, and the hemoglobin becomes totally deoxygenated and the infarcted area becomes the bluish and the vessel walls becomes more permeable, the cardiac muscles begin to swell, there will be the diminished cell metabolism and the cells with the no blood supply begins to die. This is all happens in myocardial infarction. There are other causes of death after acute myocardial infarction such as the decreased cardiac output, the pulmonary edema, the ventricular fibrillation of heart and the rupture of heart. Now coming to the last topic is the pain in the coronary heart disease. Whenever there is a coronary insufficiency, then there will be the ischemia develop. Development of the ischemia is due to the hypoxia, which in turn causes the release of the acidic substances such as the lactic acid, histamine, kinins, proteolactic enzymes. These substances stimulate pain nerve endings that eventually stimulate the CNS. What is angina pectoris? Whenever there is a progressive constriction in the coronary arteries, it causes pain in the heart and in the area surrounding the heart, which is called precordium region. The pain which actually produces in the angina pectoris is a rapid pain. It is a type of the rapid pain which occurs on the left side of the arm, shoulder, neck, face and chest. In chronic angina pectoris, the pain becomes severe due to the exercise and emotions. It also becomes severe during cold temperatures. Angina pectoris produces hot, pressing and constricting pain in the area of the heart and its surrounding. There are two types of treatments of the angina pectoris. The first one is a short-term treatment and the second one is the long-term treatment. During the short-term treatment, the vasodilators such as the nitroglycerin, nitrate drugs, and ranolazine may be given to the patient. In addition to these vasodilators, there are other substances such as ACE inhibitor, angiotensin converting enzyme inhibitor, and angiotensin receptor blockers, and the calcium channel blockers can also be used as vasodilators. We can also apply the long-term treatment to the angina pectoris patients. We can apply the beta blockers such as propranolol. So up till now, we have discussed how the blood flow and the cardiac output change during exercise. After it, we have discussed the coronary circulation, and in the end, we discussed the diseases which are related to the coronary circulation insufficiency, which are called the ischemic heart disease. Thank you.